Hey, and welcome to another episode of Psych. Now today I've decided to take you out into this beautiful sunshine and show you where I live, which is up in the north tip of the Coral Sea. It's just beautiful here, and behind me I've got a place called Double Island, which is absolutely amazing. But anyway, regardless of wanting to talk to you about where I live, because I love being where I live, I must admit, but I really wanted to talk to you today about what it is that a psychiatric nurse does. So what do they do? What is it that we as nurses do every day, day in, day out? And to be honest, when I listen to other nurses talk about it, when someone asks them, hey, what do you do for a living? You say, oh, I'm a psych nurse, and they go, oh, what's that about? That must be crazy working with those nutters. And you think, what? It's much more than that. What do you think we do? Just run around chasing people with straitjackets and clumping them over the head to keep them quiet and injecting them, I guess. And I find nurses really struggle with this, and I also hear them try and simplify what is a really complex and difficult job. And to be honest, because you've been doing it for so long, you probably don't see it like that. And I kind of think to myself, why don't you see it like that? Why don't you see it as something that's really, really quite complex? Why do you see it as something that's so simple? Because it's not a simple task, There's lots of things that's going on in your brain at the time, and there's things that you need to do and think about, sometimes 3 or 4 steps ahead. And I kind of guess, from my point of view, when I think about psych nurses doing this, I kind of feel like they're just giving away their discipline. I don't know about what you think, but I do, that's what I think. At one time we called ourselves psychiatric nurses, and I guess that's why I've tried to always remain with that term, psych, and I've shortened it, to try and make it a bit more trendy. But psychiatric nursing is what it really is, and today they call it mental health nursing. Yeah, you're a mental health nurse. And you know what, they actually want to change that. They want to make it mental health clinician. And I'm not impressed, sisters and brothers. When I say sisters, I mean brothers as well, but to keep in with tradition, let's say sisters. And I'm not impressed with that. I just think that as a discipline, we kind of just want to give it all away, and we kind of make it sound like it's so easy, and anybody can do it. And I think to myself, not everybody can do this. This isn't a one-size-fits-all type occupation. This is something that's really, really important. And the world today that we live in, with technology which separates us, which actually stops us from communicating, and communication is a fundamental key. People, human beings, we need connection, don't we? And when we don't have that connection, what happens? The whole world falls apart. So we can't tolerate things anymore. And that's just the tip of the iceberg. It's just like mental health problems. But what about the real psychiatric illness? What about schizophrenia? What about bipolar affective disorder? What about depression? Really looking at depression, and all these addicts that we've had added into our diagnosis books that we read, the DSM or the ICD-10. These are all books that are adding to this very, very what appears to be a really complex subject that we try to make sound so easy. So today, I just want to talk about what it is that us as psychiatric nurses do, and what it is that we do for our patients, and what we do for ourselves, and why we are different from other disciplines. It's really important to remember that we are different, and that's okay to be different, Hey look, so I've decided to come to different places along the way, going up to Port Douglas actually, and just so things can be a little bit more quieter, so you might get some traffic noise in the background, but that's okay. Look, the other side was just windy. I'm going to have to try and blur out some of the sound, and it just didn't sound that good for you guys, and I want it to be a nice experience. I don't want you to think that I'm just whacking these videos together for the sake of it. So you know, as I was saying before, I just think that, you know, psychiatry is kind of made out to be something that's not important, that anybody can do it. And, you know, psychiatry, like psychiatrist, like psychologist, like psychiatric nurse, are all specialist words, aren't they? You know, and to suggest that it's just mental health clinician kind of just makes it feel anybody can do it, you know. And I'm sure at the end of the day, there's other disciplines out there that feel the same way as me too, you know. I'm sure that we don't want to be thought as just anybody can do it clinicians. We specialise and we train in that, don't we? You know, there are even some disciplines out there that say the psychiatric nurses, the only difference between me and them is that they give out medication. What? People come here from miles around just to do all of this sort of stuff. Yeah, so as psychiatric nurses, what we try to do and what we're taught as a discipline is that we need to rule out the physical first. Psychiatrists obviously have their focus, which is looking at what they want to actually diagnose and how they want to treat. And, you know, occupational therapists would be wanting to look at someone's functioning as well as their mental health. A psychologist would want to be looking at therapy and what they could do for the person in therapy as well as their mental health. And the first thing we have to look at is the physical. We have to rule it out, because the last thing we want to do is be treating somebody in hospital with something for a delusional disorder when they could just be drug affected, or they could be just having they could have a UTI, you know, who knows. So, you know, and I think it's the same for other disciplines as well. They like to be considered as specialists in their area. And that's why we have multidisciplinary teams, don't we? So the patient can benefit overall. So what I'm trying to say is that psychiatry and psychiatric nursing has its place within that realm. And I wouldn't like to think that I was treating anybody from the same perspective. I might consider some of those perspectives, but I'd kind of ask the expert, wouldn't you? I mean, isn't it arrogant just to assume that we're all the same? Hey, look, what I want to make quite clear is that this isn't a political statement. It's not about working in silos. I just think that you've trained hard and you've worked in one discipline, and I think it's a shame just to give that all away. You know, I think as well that we don't say much because we fear that we're going to offend somebody. Well, sisters, to be honest, the only people that you really offend are your own discipline. You know, and that's not what we're about. We should be proud of what we are and be able to take that forward into our patient care and demonstrate our expertise. You know, I'm not trying to blow sunshine up our asses here. I'm not saying I'm better than any other discipline, because I'm not saying that at all. What I am saying is that, you know, you started out as a nurse, you trained in that discipline, and you should continue in that discipline, and I don't think that you should give it up so lightly. Anyway, look, rant over, okay? What I'll do is from now on, I'll just get into what a psychiatric nurse is. So the role of the psychiatric nurse doesn't just play aid to a person's physical recovery. They also take in what's called the holistic approach. So they look at their psychosocial needs as well as their spiritual needs. And this is all done in conjunction with the family as well. We like to think that we involve everybody, including the carers, because they play an important part for anybody that's looking after someone with a mental illness. They kind of act as their guide when they can't guide themselves. And, you know, we try to encourage all sorts of things like advanced directives, for instance. I'm not too sure what they call them in your part of the world, but they call them advanced directives in this part of the world. And that just allows the patient that when they're well, they can actually have some say in what sort of care they would prefer. This doesn't necessarily mean that they're going to get what they want, but what it means is that at least the team are actually considering that person's needs from their angle, and they do that through their carers, and their carers are the ones that are kind of suffer as well, you know, and they see the person fall down and they wait for the person to be able to get up again. And, you know, it's a story that we tell, and it's something that we try to be involved in as much as we can. So psychiatric nurses are not just there giving out medication, they're also looking at the needs of the patient as well. So psych nurses also offer education to people that are involved, and this isn't just for short term, this is for the long term as well. So we're looking at educating not just the patients, but as I've said before, we look at educating the family too. We also educate other organisations as well in where our intentions are, and possibly any recommendations that we might have as well. And these are all things that are useful for the patient and aids them in their recovery. So where do psychiatric nurses work? Well, we don't just work on wards. You'll find us in lots of different places. Asylums have long since gone, and even places like small, medium secure units are no longer available for patients to take advantage of. So where do you see psych nurses? Well, at the very worst place you'll see a psychiatric nurse is in the ward itself. Not to say that wards are bad things, but to suggest that perhaps they're more restricted than what they would be in the home. So you will see psychiatric nurses in the home too. You'll see them in homes, you'll see them in the communities, you'll see them as case managers, you'll see them as intensive case managers, which are slightly different from the normal case manager, and are what they suggest that they are, which is intensive. And you'll find them in crisis teams as well. Crisis teams are there to react in emergency, and now the more popular focus as well is even to get further into the acute stage of that and treat it at its source, and that's in co-responding teams with police as well. So you see us running an ongoing long-term case management, you'll see us in short-term case management, you'll see us in crisis case management, and you'll see us before the crisis gets to the point where it needs to even consider hospital as well. You'll see us in public hospitals, you'll see us in private organisations. You'll see us in organisations that are not necessarily dealing with public mental health, but they'll be looking at through NGOs, through other services, of how they can support people that struggle at times with their mental health. And you'll also see us in places like in Australia, for instance. You'll see them in the Royal Flying Doctor Service as well. Getting out into communities where perhaps it's not so easy for someone to have access to mental health services, and mental health services get flown in. Psych nurses will also talk to patients about using external supports. And this is particularly useful for people that may be isolated and not have those opportunities to get out and about as much as they could. They may need transport to get there, or they might feel uneasy about meeting new people, particularly if they have a paranoid illness or something like that. I think it's worthwhile mentioning that these other support services are such a benefit to our patients, and being able to offer our patients, and being able to offer our patients alternatives apart from us is a fantastic response. And again, that involves using other disciplines that specialise in those particular areas. So we're kind of educators and we're advisors too. Psychiatric nurses treat people in the community or in their homes. The idea and the principle really is that, in line with the Mental Health Act, psychiatric nurses try to treat people in the least restrictive environment. And we're better to do that than do that in the home. Okay, so psych nurses are also employed to assess risk, and that's the risk of the patient. That might be the risk of the patient to other people, or to themselves, or from other people. And there's lots of risk more than just suicide and self-harm. There's the risk of being vulnerable towards other people, particularly if they are quite disinhibited, a damage to their reputation, things like that that are considered to be a risk to the patient themselves or other people. They also look at the environment, and they look at it at the time that they're actually assessing it. Yes, you can look at the long-term longevity of something, but you've got to look at it from an acute setting, particularly if you're an acute nurse. If you're a crisis nurse, you've got to look at it from a crisis setting. So they use that professional judgment to look at risk. So psych nurses also have the ability to respond appropriately to tricky situations. So they can respond to situations that otherwise might be just get out of control, but they're able to de-escalate. So there's another thing that you've got another feather in your cap, if you like, psychists. Psych nurses also look at the well-being of the patient, not just from their mental health consideration, but from their physical consideration as well. And in order to do that, psych nurses are quite skilled at building rapport with their patients. Some more skilled than others. Look, but it is a primary factor of a psych nurse to be able to build rapport with people. They're expected to be able to build that rapport so they can deliver a much more effective care at the end of the day. And that's what we want to do. We want to deliver effective care to people in a timely manner and something that's relevant to them. And you need that by building rapport. Psych nurses have the ability to hold group therapy sessions. A lot of us decide that we don't want to do group therapy anymore when it's something that was sort of cool. So other disciplines sort of jumped on board and said, well, you know, we'll have some of that. So, you know, you do have the ability to have group sessions, and that could be anything from looking at self-esteem to sleep problems, all sorts of imaginative ideas that can come into your mind and you can run a group session for. And I strongly recommend it. You know, psych nurses are really good at holding group sessions. And not forgetting what I was talking about earlier is that we do actually give out medication as well. We're legally allowed to administer medication, and some of us can prescribe medication if we have a particular certificate which allows us to do so. So I guess, you know, people are right, psych nurses can administer medication where others can't, but that's not something to be taken lightly either. You know, we don't just give out medications and not understand what those medications are for, and what side effects those medications can have, and what indications could happen if they use them in conjunction with other medications. And that's something I'm not going to get into today, but it's something that psych nurses obviously need to know, and do know, and are aware of their obligation to understand that. But again, I don't think other disciplines appreciate just how important that is. If it was a case of simply giving someone a tablet and not worrying about it, you know, whether they might have some respiratory failure, or whether they might get elevated in their mood, or they might get more disinhibited or irritable, you know, by giving them medication, particularly when they're displaying a set of symptoms anyway, I guess it's kind of important. And it's worthwhile noting, yes, psych nurses give medication. So psych nurses, just remember that you are good at doing documentation as well, which is a subject that we'll go into at another time. But just for the sake of today, just to let you know that you complete full MSCs, you do risk assessments, you formulate opinions and recommendations, and you offer plans. And that's not something to take lightly. So look, psych nurses, what I'm talking about is really just the tip of the iceberg. You know, and when you consider that you are a specialist person and at times you may be struggling to identify what it is you actually do, but I hope you get a little bit more of an understanding of what you actually do and why you actually do that. I think people need to understand that psych nurses are a specialist area, and they're not just people that give out medications. They are people that actually try to build rapport with their patients. They assess them on a consistent basis. They assess their risk. They look at the functionality of how they are living at the moment and how that can be improved, if it can be improved. What sort of supports are in place for them and their families, and continuously looking at how they can be managed in the most least restrictive way. And that doesn't just mean in a ward or not in a ward. It also means, you know, if it's a case of do they have such medication? Can they have different medication? Would it be advisable perhaps to look at weighing up whether the medication's working enough compared to the amount of side effects they're getting? You know, things like that are all really relevant to a patient, and they kind of explore not just what's actually happened to them there and then, but what might be happening to them in the future. So I guess, you know, psych nurses, you know, you need to look at your life in a little bit more detail, and understand that, you know, what you have to offer is a lot more than just giving out medications. You know, psych nursing is not about just restraining people holding them down, forcing them to do things that they don't want to do. It's a lot more than that. So I guess from our point of view, you know, psych nursing needs to have a little bit more of a presence. It needs to be a discipline that is maintained. It needs to be a discipline that is preserved, because it's there for patients to take advantage of and get a different perspective, a much more specialised perspective, I would say. Anyway, take it from me, yeah, that I think personally psych nursing should be something that should not be minimalised, and it should be something that should be highlighted. It's a specialist tradition, and some traditions are worth keeping. I don't know. You tell me what you